Start event.
Yeah.
Okay, good morning, good afternoon, good evening, everybody. We will get started in just about a minute. I think there's still a few people joining. Thank you so much for joining us today on our webinar where we'll cover the latest updates and guidance for employers as it relates to COVID-19 in India. Okay, so I think in the interest of time, we will get started. Looks like we're at the top of the hour. My name is Michael Green, and I am the Director for Government Relations and Strategic Development for Sanam S4. I'm based out of Washington, D.C., but previously had been Sanam S4's General Manager based out of Mumbai. So those of you not familiar with Sanam S4, we're a market entry firm. In India, we have a long history dating back to 2008 when we got our start. We support our clients for market entry and then all of the ongoing local management compliance of their operations in the market. We have 5 offices in India and over 230 staff. One of the things that we kind of in our ethos is that everything that our clients are going through, we are going through as well. So, of course, the COVID-19 global pandemic has been something that has had huge impacts on businesses, governments, and has impacted our daily lives. I'm calling from my home in Washington, D.C., and my colleague Susmita Sen, who is our head of HR advisory, is calling in from home as well. And we'll talk a little bit more about why that is and work from home here shortly. So I think in terms of today's webinar, what we want to do, and things are very developing very quickly and on a day-to-day basis, is provide you the latest, updates that are happening from the central government, but also the state governments. Talk a little bit about the disaster recovery plan and what measures employers are taking to be able to cope with the current situation. We'll cover people-centric decisions, sickness protocols, and we do have a slide with some resources to share with you. Backing up one slide, we don't have the, just so you can see our faces here briefly. Again, Michael Green based here in Washington, D.C., and Susmita Sen based in Delhi. Susmita has over 2 decades of experience working with clients on various different kind of matters, and I'm happy to have her here with us today. So I think what I would like to do is turn it over to Susmita and just ask the question, kind of what is the sentiment in India, particularly given the Prime Minister's address, which was yesterday. So I think maybe just an update on that would be really helpful before we get into some of the specific announcements at the central and state level.
Yeah, thanks, Michael. Hello, everyone. Good morning, good evening, good afternoon, wherever you are logging in from. Thanks for joining us today. Yes, Michael, COVID-19 we know is a global humanitarian challenge right now, and the situation world over is grim. Thousands of healthcare professionals and frontline support staff heroically trying to battle this pandemic at the cost of risking their own lives. India is currently on high alert, and the rise is because of the confirmed novel coronavirus cases in the country. This morning have been quoted at 197. which was quite a steep rise from 175 yesterday. The Prime Minister's addressal to the nation touched upon five predominant points, starting with the essence of self-quarantine, why and how it is important, and how we should stop taking this virus casually and build in more behavioral restraint in our lives to self-quarantine ourselves as much as possible and avoid marketplaces, avoid crowded places, avoid gatherings, avoid social places, etc. No hoarding of essentials was the second message. Think about your neighbor as much as yourself. If you hoard, there are elderly, there are aged who do not get access to the resources that you have hoarded. So be kind, be thoughtful, as we go along. Gratitude to all the frontline healthcare staff. They are, and therefore we are. Avoid hospital visits for any non-essential, non-critical ailment that you're going through. Try and call up your, physician, your local physician, or your family physician, and try to get remedies on call. There are a lot of websites that are now offering you a lot of medical advice on calls, on emails, online, etc. Do try and tap in all of those resources. And finally, last but not the least, it's for organizations to, at this time, that they have a much larger responsibility to deal with empathy and show to their employees that they do care.
Susmita, thank you for that. I think, being here in the U.S., it sounds like the messaging is very similar to the messaging that we're hearing here in the U.S. in terms of not, kind of hoarding resources, in terms of, the concept of social distancing. Moving to kind of, I guess, some of the more specific regulatory developments and announcements from the central government. I know there's the Disaster Management Act. There was the Company Affirmation of Readiness that was also kind of passed today. Could you explain a little bit what measures the central government has taken in its response and the impact on employers? And then we can kind of move to the states, because I think they are a big piece of this picture.
Yeah, absolutely, Michael. So the Disaster Management Act of 2005 has been invoked, giving wide powers to the Ministry of Health and Welfare, simply to enhance preparedness and containment of the virus all over the country. And the various state governments have also been empowered similarly. There is another act which is called the Epidemic Disease Act, which provides, gives local administration authority to impose, various containment measures such as quarantine, closures, surveillances across, etc. So the central and several state governments have been issuing numerous advisories, and we've been noting all of them. So we've been kind of closely tracking all the evolving advisories coming through since the beginning of this month. And any person disobeying the orders of the government in this regard shall attract the punishment as provided for disobedience to order duly promulgated by public servant under Section 188. So, which means the Disaster Management Act and the EDA are applicable and are enforced currently by various state governments, especially Kerala, Karnataka, Maharashtra, and New Delhi right now. So these are the more critical states. As we all know, as of yesterday, all inbound airline travel to India has completely been banned. We know that tourists who have been coming into India in the past couple of weeks have been thoroughly scanned and checked in the airports. for their state of, for their physical state, for their to verify them completely and thoroughly, to self-quarantine them if they have been returning from CDC level 3 risk countries like Italy, France, Spain, Denmark, the European country, EU countries, etc., or from Korea, China, etc. In India, the Karnataka and Haryana have also kind of given a blanket closure to even Delhi, blanket closure to, to again promote the bit of uh, social distancing and isolation. All marketplaces, bigger marketplaces, malls, shopping complexes, gyms, salons, etc., have all closed down to ensure people are able to quarantine themselves enough. As of yesterday, the Maharashtra government had made it alternate days of office of work from home, which is kind of mandated to all private organizations closing down, and a mandatory work from home in Mumbai and Nagpur in Maharashtra this morning. So that is how quickly the situation around the various states and cities is changing, Michael. The state government of Andhra Pradesh is also asking all recent and international travelers to go on a 28-day self-quarantine. Kerala High Court recently has intervened to ask the government to control distribution and prices of the masks and sanitizers, and this is coming from that, hoarding of these items in this state, which was where the virus really started off in India. So these are some of the developments, in the various states in India, and the close watch that we're keeping is on the Ministry of Health and Family Welfare site, which is updating all numbers and the advisories that need to be going out to organizations and to individuals for all the healthcare measures that we must take.
Thank you for that. I think one of the things that I just do want to mention is in and around the visas for those who do have staff, foreign staff in India. If they're on an employment visa, those visas have not been revoked or anything. Diplomatic and project visas, but all other visas as of May 11th have been suspended until at least April 15th. So, I guess I'm not sure how you would get there if you can. If there's no commercial flights now as well. So I think that's a good example of how this is developing, so rapidly. But back on the 11th was when visas were canceled. Or suspended.
Yeah, that's right, Michael. In fact, so people who are on visa, their visas haven't been revoked. The only thing is if they are on a short term, and the visas are set to expire in the short term, and they do not have the luxury of going back to their country to kind of revise the timelines, then they are being advised to go to the consulate, visit the consulate or the FRRO for the relevant assistance.
Okay, that's helpful. So if their employment visa is ending at the end of March, and I know a lot of businesses plan based on the typical fiscal year in India, April to March. So there could be, and I'm sure there are a number of employment visas of foreigners that are due to expire at the end of this month. So those that haven't been updated already, Susmita, the guidance from the government is to go to the UK, US, or your own consulate to seek guidance. Is that correct?
That's right. And there is also the FRRO, the Foreign Registrar's reservation office which assists in these matters.
Okay, got it. In terms of the going to the next slide, in terms of the employer checklist, what are some of the strategies organizations are adopting to ensure business continuity? So, Susmita, if you could shed some light on that. And again, I think it's interesting because the way that this is developed, or I've seen this develop in India, is that initially, the offices were still open, but they were taking some, additional measures. And now I think the guidance is very much kind of work from home. So these business continuity plans and work from home become even more important. So could you speak a little bit to that?
Yes, Michael. So, yes, well, this has completely taken us unawares, and so a lot of organizations, and there are like daily advisories there, and that's typically because people and organizations leaders have been caught completely unawares uh, uh, with this pandemic kind of breaking out, with this kind of exponential growth. The business continuity plans starts off with the close engagement with the government to stay and rely on relevant resources that can provide guidelines on what are applicable and what are mandated actions in the applicable jurisdictions that I have been speaking about previously in terms of state-led measures and specific measures in cities which are led by the district magistrates, etc. The Ministry of Health and Child Welfare and specific public health guidance is what is being mandated all across. The official guidance should serve as the foundation for organizational decisions because health and legal risk mitigation is important at this stage. So, for example, it is very easy to kind of toe the line and be caught by employees or by the government to say that you're not following up here, and here is the penalty that is being slapped on you. And it's also the right time to demonstrate corporate policy alignments with official recommendations, because that is what is required to stay legally safeguarded and quarantined from any kind of infection controls, etc., that may be challenged later. The other point, very importantly here, is leadership contingencies. Typically, all global travel, etc., is taken care of by CXOs who are at very high positions, and typically they are the ones who are decision makers, etc. Now, a lot of that clan seems to be quarantined and down and under this viral attack, and therefore our organizations prepared with their next line of decision makers, who with the organization going to follow through, who are going to take the next critical decisions, are how are they going to decentralize their decision making so as to keep the organization nimble and agile, etc. So that's the next point that the organizations are very quickly thinking through, setting up their next level of succession pipeline in place, so that there can be decisions are not pending for a long period of time at this very crucial juncture. Keeping up with sanitation protocols, as we all know, is a mandate that every organization is following in terms of communicating to employees about health and hygiene, about ensuring the workplace is sanitized, ensuring visitors are there are thorough checks on visitors that are conducted, and robust surveillances on employee health are also conducted. Keeping a two-way communication on to ensure, in case there are reporting of, employee health, travel history, etc., that does come up, all confidentiality is maintained on records that come to employees. And finally, it's about the messages to stakeholders. How are organizations managing their clients and stakeholders by allowing them, provisioning to them that while there are the modes, there are flexibility of that is being built in to do the work, to execute the work, yet that does not mean dilution of productivity or efficacy in any way. So building that line of confidence through communication with customers, stakeholders at every point of time, and ensuring that we are prepared for any potential contingency measures. These are few of the business continuity plans that organizations are very strongly working on. Michael? Michael? Okay, I am not sure. Michael seems to have, there seems to be an issue with his voice line. But yes, let's take the next point, which is about the work from home aspect, which every organization is now mandating, every government is mandating, etc. In Bangalore, we know the Karnataka government has issued notifications to all the software technology parks, because that's again a huge hub of manpower trains, to kind of make allowances for work from home. There are alternate days, 50% of the workforce showing up for those kind of profiles that need to show up, which are operations driven, which are more workflow driven, and therefore cannot manage remotely always. But for the rest who can manage, its work from home for most roles, profiles across the board in various places. And that is keeping in line with the social distancing that as responsible citizens, everybody needs to adhere to. But the key questions on work from home are the organizations ready for it? And what are some of the key questions there? Is there enough technology support? Is cybersecurity good enough? Is it in line with your confidentiality measures? Are the servers up to date, and will they kind of support remote access to all your employees working remotely? How will it be secured? Uh, Cost of any operational changes or advancements or technology investments if you have to make, and what kind of communications are required, and what kind of policies need to be adapted to make this work. So very first point here is on infrastructure. So do people have the requisite technology or access to it? Do all roles and all employees have an access or have been given a laptop that they can carry home and work from home? Will those who do be able to dial into their organizations easily? Will they have software that they need to work, like conference calls, etc.? What are the various means and modes? Do managers have so managers need to kind of quickly make an assessment of all these needs and ensure that every employee has full access, so no one feels left behind in this game. The next big point that I, in my last few conversations with many of my client teams, have been dealing with is, and a typical people manager question is, I've never done this. How do I manage my teams remotely? How often would I need to communicate? How do I know what they are working on, etc.? So there is this feeling of um, uh, losing control. There is this feeling of lack of communication leading to some kind of service dilution, etc., etc. So there are very, very, very many ways, and this is what I've been telling them, that set smaller milestones for evaluation and feedback. Make touch points, build in a discipline to make this participative, so that you ensure you're talking to all your team members almost on a daily basis. You've got to help people understand how to do this and give them the confidence that it will work. As a line manager, that's your responsibility. Newer employees who could be struggling with it, etc., or some employees who are on critical and deadline driven roles, client facing roles, etc., need much more hand holding at this time. So make sure you have enough time and guidance for them, and build in that extra time for on your schedule, so that you can remotely assist them. Remember that you can do
Test, test,
fun things.
test. Susmita, can you hear me now?
Yes, I
Sounds
can.
like it. Okay,
All right.
great.
Sorry. Yeah.
Apologies, everyone. I think we're having some connectivity issues, both on the, I think some individuals are having some connectivity issues, but I've been able to hear Susmita loud and clear, and hope you have as well. And now I'm back online with my headphones on. I took them off because somebody had said that they weren't able to hear me, so I took them out, and then I think got locked out somehow. So back on point, and Susmita, thanks for picking things up.
Yeah, no worries, Michael. So we're at work from home, which is the current reality that we are facing. So, like the fundamental change, the way many organizations operate for the foreseeable future is work from home, and that's what we were talking about. And we were also dealing with, so work from home is one thing, but not many organizations, not many people, managers are oriented to do this well and be confident about it. So, how do we build in confidence? How do we coach them and guide them to what they should do? And how can they also make it fun for their team? So, for line for the managers is also to remember to do all the fun things virtually. So, your happy hour breaks, lunch together, etc. Conversations can all continue remotely. So, make sure you do that. Social distancing is only physically, but not emotionally, and not on call. So make sure you build these into your daily routine to keep yourselves motivated and keep the momentum going. There are, and this is what I was just also talking about, there are a lot of psychological effects of remote working, etc., as well. And so there are a lot of tools to help you, build that camaraderie, build the teams together, etc. So use your WhatsApp, WeChats, Google Hangout, etc., whatever you have access to ensure that you are in touch with your team members, you are in touch with your peers, and various other touch points who you need to be in touch with to keep yourself going on a day-to-day basis.
Yeah, Susmita, I have a quick question from the group, and that's for those companies that have staff that are more data entry clerks. How are others handling those level of employees working from home? I think there's a couple of components here that I just like to kind of pull back. And my wife is a lawyer at the World Bank, and we just had a kid. It was probably too much information. She's kind of back from her maternity leave, and the World Bank itself. She was supposed to start earlier this week, but it took an extra day or two for them to procure a laptop, since organizations are moving work from home away from desktop to laptop. So that is a transition that I think organizations around the world are facing, and I'd imagine India is not an exception to that.
That's
But Susmita, maybe you can. I think you already did touch on this a little bit, but
Yes.
how can you monitor the work?
Yeah.
What tools are out there, and how are we supporting our clients with those tools?
Yeah, so Michael, so we did speak about, how, what kind of investments. So if you don't have laptops, etc., what kind of investments organizations need to make. Also, to answer the question on data entry clerks, etc., which are essentially also front facing. There are ops people who cannot work from home. I mean, their role just entails them to be on site, and therefore, it's work from home is not something that is applicable to them. I mean, what do they do? So most organizations are bringing in, 50% of such staff at one time, bringing in smaller shifts so that a lesser number of people are in the workplace at a particular time to honor the social distancing, isolation, quarantine, etc. Principles, and not diluting them at any point. So these are some of. So if you have to essentially be on site, on work, etc., then shifts and remote working, building more work area around the current premises, etc., to more, make it extensive, to accommodate fewer people in larger areas, to build in that social distance, etc., is something that many organizations are currently working on. And of course, those who can, and if laptops are the easiest solution, then investments in laptops, technology, communication tools, etc., is being made, and trainings being given to the staff members so that they can leverage technology to the best and utilize them, for their own productive good.
Yeah, and I think that's really important. I mean, companies right now are facing a tremendous amount of pressure in terms of uncertainty with revenue pipelines, and so thinking about additional cost um, is a difficult thought to have right now. But to the extent those costs can support the move towards digitally being able to provide your products and services and integrating that, I think, is really important. I've been following the markets fairly closely, and I just looked up Dell, for example. They are up today, but I'd imagine there's going to be a huge need for laptops, across the world, so that organizations can continue to stay up and running with people at home. Susmita, anything else to address from the work from home?
Yeah, only the last point on work from home. So typically, like you said, we were talking just a little while back, and I could hear the wails and cries from the background. And you have your dog running, and you'll have your children making noise around, and that's the blurring of lines between your work and your home. And I think we'll have to build in empathy to accommodate all of this as we fight this war against this epidemic. And that's the last point I was wanting to table here.
Thank you. And before we move to the next slide, in terms of essential versus non-essential employees, do you have any kind of thoughts on that?
Yes, Michael. So I think we'll talk about it when we talk about, some of the key people-centric decisions that organizations are going to be taking in due course. So we'll talk about it when we talk about, the categorization of stuff. But
Got it.
but we start with, flexible work options, which we've already spoken about somewhat. And so work from home is one part of it. And like I mentioned, for, uh, teams and for roles that do not warrant any work from home or cannot warrant work from home, there are other kinds of shifts and physical layout changes, etc., that are being accommodated by organizations.
Got it.
Yeah, so the next is benefits leave and public safety net is a very, very key point here. We know that the leave obligations are typically dictated by the state specific Shops and Establishment Act guidelines. Employers should at this point, however, analyze their legal obligations to provide employees with leave in the event of any kind of sickness or disability and evaluate whether their policies need to be adjusted in the current circumstances, because these are circumstances out of the ordinary and therefore will not have coverage under their current policy and guidelines, etc. So how do you, so for example, if you do have an employee who's come back from a business trip and perhaps from one of the affected CDC level 3 countries, would have to go through a quarantine of 20, mandated quarantine of 28 days. Now, how do you accommodate that? Um, uh, are organizations, going to provide paid leave, etc.? This is a contentious point. The point here is that if the employee had gone on a business trip for official purposes, then the organization is some way legally mandated to take up that cost because it wasn't a personal trip. In case of a personal trip, the situation could be different. Um, why I kind of am highlighting this point is there is in India there is a employees Workmen's Compensation Act which involves employees compensation in case of any. I mean, this typically covers those who kind of get into a disability or are meet face with an accident, etc. In the workplace. Um, the the new rules are kind of conferring this epidemic as a kind of disability that it's being attributed to employees, and therefore the Workmen's Compensation Act uh, is not currently applicable but will get applicable by the state government. And therefore the Karnataka government has already mandated that all COVID cases need to be you know paid leaves by the employer, and many other such many other states are likely to follow through because of the relevance of the Workmen's Compensation Act here.
Thank you for that. I think that Susmita, I think that's an important thing to note, that in India, most of the employment, pretty much all of the employment related laws and regulations typically come down from the states. So it's really important for those that have staff in one state or another to be keyed in on what's the latest from those particular jurisdictions.
That's right. Michael, there is one more point which goes beyond the legal requirements here. So organizations also need to see the broader implications and I mean legal implications and the broader business perspective. For example, if you do not see, say for example, somebody's gone is a COVID-19 tested positive, and you do not provide paid leave to the employer does not provide paid leave to such an employee. The employee will then be at a race to kind of recover quickly and get back to work, which I'm not prematurely perhaps want to return back to work because his or her salary is getting impacted, which I'm not sure is in the best interest of the organization and the well-being of the rest of the employees in the organization. So these kind of finer nuances, and risking business continuity, etc., legal liabilities are something that organizations need to be very, very mindful of when they take decisions around building in flexibility on benefits and leave at this point in time. Um, Also, one more point that is being asked very often is, are insurances covering COVID-19 cases? And most insurances are. So the toolkit to ascertain positivity of the nature of the viral virus manifestation is given free by the government, and so all tests are being run free by the government hospitals currently. But uh, following the testing positive, whatever is the hospitalization charges, etc., is being covered by the insurance companies. So that's something by most insurance companies in India.
Thanks, Susmita. Just a couple of questions from the group. I'll take Nikhil's. What perception of disaster planning do you feel organizations are preparing for? Is there kind of are they preparing for the next 4 weeks, the next 6 months? Are there enough discussions and action for long-term implications? I'll just kind of answer that from my perspective before turning it over to Susmita. I don't, at least here in the U.S., it does not seem there is a particular, end in sight. I think there's encouraging signs that some countries have started to contain the virus and start seeing some of the confirmed cases decrease. But at the moment, at least in the U.S., if you listen to any of the leadership here, they're saying, 1 month, 3 months, 6 months, 9 months is kind of the timeline that they're giving. But Susmita, maybe you could kind of speak to that from the India context and disaster planning.
Yes, Michael. So yes, in the India context, leaders are thinking, but yeah, I mean, not at a 6-month scale and timeline right now. It's wait and watch for the next couple of weeks to see what the government decision is, whether India moves to a community level 3. Currently, we are at level 2 risk. And if we stay at level 2 for another 2 weeks, then we are more sure of being able to contain the virus and flatten the curve going forward. And therefore, it's more wait and watch for the next couple of weeks on organizations. So organizations at this time are focusing more on business continuity rather than disaster management. That's the fallback option, which will kick in once we, God forbid, reach level 3.
Thanks, Susmita. I think there was another question about college level students, and it's very dynamic time. So I just sent a WhatsApp to my colleague Lakshmi Iyer, who's our director for education based in New Delhi. And her input back is just that colleges are shut down in India. Exams are now the kind of biggest worry, as the 12th standard exams have been postponed and university exams are uncertain. So I think from a university perspective, kind of similar to other jurisdictions in that the universities are kind of shutting down, and to the extent, I guess, they can go online, trying to do that. So hopefully that helped answer your question. If there's any other kind of feedback that I get in the interim, I'll pass that along. Susmita, in terms of the people-centric.
So the last point, Michael, the most important point that you've been wanting to ask me on essential, non-essential categorization of staff, etc.
Yeah.
So yes, so that's another thought that organizations are very consciously toying with, because this is a time where new business is not really coming in. We are kind of at a certain level where we're kind of retaining our whatever we have, trying to keep the continuum on, etc. So at this stage, what organizations, a lot of them are doing is, identifying what are the critical business functions they have, and what are the activities which are the prioritized activities, who are your most critical, essential employees, etc. Who you would need to run your businesses and run the and keep it status quo. For all the others, this is the right time to see, evaluate whether there can be job rotations, role rotations, put them through learning interventions, open platforms where a lot of learning can come through, etc. And therefore, and thereby build in people, build in talent to face the future challenges, and see how you can modify your um, prioritized activities, and have more skill built in there, more people, more talent built in there. Cross train employees and establish, covering arrangements so that you minimize disruptions. So because of your shifts, etc., you could have certain disruptions, but you should see, how many people you can cross train to kind of fill fill those gaps in, and minimize any kind of disruptions in organizations.
Thanks, Susmita. Another question, and again, unfortunately, with a lot of these, with the current situation, no one has a crystal ball in terms of exactly what to expect. But the Prime Minister issued the Janta curfew, I believe, to begin this Sunday. Is that correct? Do you see that being extended beyond March 22nd?
Okay, so I have no authentic source to kind of corroborate what I'm saying right now, but I see this measure as a very smart move from our Prime Minister in trying to make the first step towards encouraging people to maintain social distancing and build in self restraint. So once you're able to, he's perhaps trying to experiment with this for the 22nd, that Sunday, and basis the success of that one day, it could be a repeat episode, which could be followed at a certain frequency to break the human chain as many times as possible, because that's the only answer to, breaking down this virus chain.
All right, and I realize we had allotted about 45 minutes, so we're at that point, but we'll continue until we've addressed everyone's questions. I'll pick up those questions at the end, though, and in the interest of time, so Susmita and I can get through the presentation. What are some of the directives, Susmita, on travel being followed domestically? We know all of the flights coming in are off. What's happening domestically?
It's all it's very simple, Michael. Right now, there's a blanket ban on all non-essential travel. So managers are not approving of any kind of travel, even within the country, which is non-essential. Again, more remote meetings, Skype calls, discussions, etc. In fact, I just saw a directive released yesterday by the Ministry of Corporate Affairs, saying that the minimum quorum that's required for a board meeting is no more required for physical presence. People can be remotely running meetings now, and as long as the quorum is there in remote presence as well, it's as good as having a board meeting, an authentic, a genuine board meeting. So that's on this discouraging any kind of usage of public transportation where the risk of exposure could be higher. Introducing travel health and safety kits for all kinds of field and service workers who are empaneled with you, and also track official travel restrictions on a day-to-day basis, and provide support to staff members that may be stranded away from their homes because of these restrictions that have been imposed.
Got it. Okay. In terms of any other kind of best practices before we kind of move to sickness
Uh,
protocols?
yeah, so I was just going through, having a few discussions with a couple of friends, and I got to know that a lot of these, few of these MNCs have started their COVID helplines, wherein you can call, set up apps, wherein you can just log in your information or whatever is your query, etc., and you get all answers to who is the nearest doctor, which is the hospital, or what should you do, what should you do in case you are you think you are exposed, etc., etc. So there are a whole lot of FAQs covered, and there are these helplines set up by some organizations. Some other organizations also have wellness helplines set up, because this is also a time where people are going through a lot of emotional duress, and it will need a lot of to build in a lot of inner strength and resilience, and therefore psychological support is what is provided through these wellness helplines, where you have a coach or a wellness coach talking you through to keep you emotionally, morally positive.
Thanks, Susmita. In terms of the sickness protocols, can we move to that? Can you walk us through exactly how employers should be working, kind of addressing sick employees?
Yeah, so the protocols are again pretty simple here, Michael. So if you have an employee reporting sick to work, I think all employers are now using extremely robust measures to and so of surveillance of employee health. So temperatures are checked, etc. You're keeping there are task forces who are keeping a watch on employee health around the clock. And if there is any there is a case of an employee reporting sick at work, the employer makes every effort to ensure the employee goes back, meets with a medical practitioner, and relates all the tale on travel history, etc., etc., and any kind of possible risks, etc., all that assessment, and then given the right kind of advice and the medical support to see him or her through this time. And it's also mandated that all such sick employees should not report into work till they are completely um, fine and fit to get back to work. In case employees are reporting sick at home, again, the same protocols to follow, that they need to, follow. In case an employee um, uh, seems to have reported a possible exposure with a partner who's traveled abroad, or friends they've met who've traveled abroad, and maybe countries or friends or partner who's tested positive, etc., then there are clear guidelines on what they should do in terms of, the Ministry of Health and Family Welfare has clear guidelines. The CDC has guidance on how to conduct a risk assessment on any potential exposure, etc. And that guidance is provided. The employer ensures all that guidance is provided to the employee, so that he and she can take the right recourse, and get back to health.
Thanks, Susmita. I think we're coming up on the top of the hour. There are a few questions that have come across, and I think some of them are a little bit difficult for us to answer. But one of them is about using essential services within offices if there is in fact a lockdown. This is a question from a professional services firm. But they'll still want to have access
Michael,
to
briefly.
needed tax and accounting.
Question, please.
the question is, so if there is a lockdown, will we still be able to use the office for essential services? We are a professional services firm, and in the US, we have lockdowns, but still are able to access the office to perform needed tax accounting work. Is that similar in India, or is there a law around that yet?
So there is, so when you say a lockdown, I mean, there are different interpretations to a lockdown. In terms of closure, so if I can understand this clearly, in terms of closure of office premises, in case the government or the district magistrate mandates a closure of all private firms or professional services firms. So if you fall under the light of Shops and Establishments Act, etc. And if you're a private firm, then and there is a mandate to close down, then then the lockdown applies to you as well, and you will not be able to access or perform your job in the office premises. You will need to ensure that you make allowance for carrying all the stuff that you need to perform your regular services back home, so that you can, your work can go on undisrupted.
Thanks, Susmita, for that. And I think, Prashant, we will be having a webinar next Wednesday on March 25th. Keep an eye out for that. We'll be looking at the situation, particularly from a tax, finance, and compliance perspective. As Susmita has mentioned, the Ministry of Corporate Affairs has been coming out with a number of guidances to relax certain regulations. I know here in the US, there's at least rumors about extending the personal income tax deadline, which is set for April 15th. So I think governments are reacting to this on kind of all fronts. We'll be doing our best to update our clients and others on those updates. So keep an eye out for the webinar on the 25th. The other question was about the total infected in India and how many deaths.
Total infected in India this morning, I think, was 196 this morning.
Yeah, you said 197 earlier. Yeah,
197. Yeah. So the latest numbers are flashing on the Ministry of Health and Family Welfare site. It's right on top there. Saying I'm not sure you want to track those numbers, etc. But yeah. If you want to, that's the site to go to.
Susmita, and I think others on the line, at least it's my impression that no matter what country you're based in, the number of people infected is impossible to know because there's so many carriers of the disease. So I think everyone needs to operate on the assumption that you have the virus personally and that anybody that you interact with has the virus. And I think to the extent every individual can, operate on that assumption, we'll all get to the other side of this sooner rather than later. But in terms of the number of people infected, I don't think any government would be able to provide you that information. Yeah, so I think somebody had mentioned about, thanks, Rick. The tax deadline in the U.S. has been extended to the 15th. I mean, this is how rapid, or July 15th. So this is how rapidly things are developing, across the globe. I am mindful we only have 2 minutes. We only have 2 minutes left. We did share just some kind of basic information, as Susmita had mentioned, the WHO, the Ministry of Health and Family Welfare. I think as businesses do communicate out to employees it's extremely important that you're referencing um, and pointing people to the same resources, because I think one of the there is a lot of fear of misinformation going out there that creates that just exacerbates the situation that we're in. Um, so with that, I think I'll wrap up. I hope we can see you again next week. A few of my colleagues, Ed Dixon, who's based in the UK, Abhinav Sood, and Christine Potter will be leading that discussion on the 25th. So please keep an eye out. We have recorded this, so I will make sure that everybody who's registered for this event does receive that recording. And with that, thanks, Suspita, and
Thank you, everyone, for making time and joining us.
and everybody, please stay safe, and we're happy to follow
Stay
up with any questions you have.
Stay
Yes,
positive.
that's right. I'll put my bye, everybody. I put a dress shirt on, so I figured I had to give it some play. All right.